The work of cardiologists in Fife could be a game changer for those fitted with a pacemaker. Teams based at Victoria Hospital in Kirkcaldy have been performing a new method of the procedure, which they say has led to better outcomes for patients. The operation has become far more simple in recent decades, with recovery times improving. Lewis Mickey has more.
Well, half of the pacemaker is in. The first wire has gone in.
Dr. Singh is fitting his patient with a pacemaker at Kirkcaldy's Victoria Hospital. Years ago, this would have been a much longer procedure, with days or even weeks of recovery in hospital. But medicine and technology have progressed, making it far less arduous.
When we go all the way back to when we first started out, it has changed significantly. Nowadays it's a minor procedure, relatively speaking, of course. As we discussed, we do it under local anaesthesia.
And the team here in Fife are continuing to harness emerging tech and new methods, some of which were previously only available in London.
And particularly this new technique that we offer here in NHS Fife called left bundle branch area pacing. When we first started out in 2022, the only place that you could get it was probably down in London in one of the big centres. But we were quite keen to change that. So this is a pacemaker, and every pacemaker is comprised of two components.
The pacemaker itself is now fairly small, but it hasn't always been this way.
I got it when, like I say, I was probably like P4, P5.
This is what Natalie was originally fitted with in the 1970s. The size difference even more stark when you find out she was just months old at the time. The teacher had been through a number of operations in the years since. Just a few weeks ago, Dr. Singh operated on Natalie to update her pacemaker. Fortunately, having her children home from university for Easter break has helped with the recovery.
My mum carried me round with what she said looked like a portable radio, and for the first month I had this external pacemaker, and then at 3 months I had my first internal pacemaker implant, and now we've got this synchronising pacer to the heart. Yeah, and I do feel the benefit of it already. Why not celebrate all of that? Celebrate that if you need medical attention, it's here on your doorstep. There's all these people who are making it their life's work.
I've been doing this for many years now, and it never gets old. We always review our patients, bring them back and see how they're doing. Sometimes we need to tweak the pacemaker settings, and every time I see my patients and they tell me about how much change this has brought to them, it definitely gives me that little bit of satisfaction for the job that we can do.
These are developments which are good for those in Fife, but could have a positive impact for those further afield too. It's certainly giving people like Natalie more reassurance and an easier bounce back, all of which means more precious time with family. Lewis Mickey, STV News, Kirkcaldy.